4 year of efforts, and again, so many thanks personally to Dr. Sami and his team from Ministry of Health for obtaining this honor, privilege, and I think this Regional Center for Excellence on Emergency Preparedness for Humanitarian Health Emergencies is very timely. What COVID has taught us in Turkey and across the region and in the globe, and core capacities which focus on member states' capacity in terms of preparedness, response, risk communication, communicable disease surveillance, human workforce, legislation. So all these core capacities which are essential to address a health security issue, this center, working with and utilizing the experience of Turkey and the capacity, yes, 1 in 10 on an average is infected, but the proportion of infected in countries varies. High-risk population varies. So what we are trying as WHO to tell the world is, schools are part of the community. Unless you control and prevent the infection at the community level, schools will only reflect what is prevalent at the community level. So trying to reduce through masks, physical distancing, risk education, involving the community, improving testing, contact tracing, all those elements that will reduce the burden of the virus and infection in the community will also help us open schools. Schools are not independent of the community setting. However, now what we are saying is that when you open schools, also we need to make sure that in the background, the health system's capacity to contact trace, and continue with education and testing should be a continuous factor responsible that will support opening of schools also. So that is one factor. Schools are not independent of the community. Second, we also need to educate the youngsters who are now going to schools and universities. That is the age we are seeing now after relaxation of lockdowns, as the increasing numbers getting infected. So what we need to involve them is to adopt mitigation behaviors, have the masks on, be physically distant, so that if the infection in them is less, the likelihood of teachers who may be at high risk because of age, comorbidity, diabetes, hypertension, other chronic diseases, will less likely be infected from them. And same way, these young students can also help transmission of infection at home level to their elderly parents, to their elderly grandparents, all those people who are working with them in the school. So that is the it's a common chain between school and the community. Based on the level of infection that we are seeing at the country level, yes, in terms of testing, in terms of contact tracing capacity, in terms of strong primary healthcare system, family physician model, and filiation teams, we have now over 10,000 filiation teams ready to go. If we were already anticipating that in times of flu season, we may have an increase, and of course, school openings are coming. So ministry has strengthened its filiation and contact tracing capacity, testing capacity. We have already tripled from where the ministry was in April. Now we are doing 200 times, 300 times more tests than we were doing before. So yes, capacities are there. But again, no country in the world can be ready and meet if the community does not wear its mask, does not physical distance, if we do not observe hygiene with hand washing, then cases will continue to increase, and no country in the world will be able to meet an unending continuous increase in number of cases. So yes, we have the capacities, but it is together with the community, whole of society, whole of government approaches that will only help, not at just country level also, and as the Director General of WHO and our Regional Director of European region have been emphasizing, it's solidarity. No one is safe till everyone is safe. So until and unless we all come together, no country, no world's resources alone will be able to meet the burden of this virus if we leave it continue to increase without observing mitigation and containment measures. It was the Prime Minister of Belgium who said that yes, mask is still a critical factor and important intervention to reduce and manage this virus. However, mandatory in terms of the government of Belgium, mandatory virus everywhere and anywhere may not be helpful. However, they are still asking people to wear it based to the best of our knowledge,
to wear it in crowded places where you cannot, in crowded places, plus those places where you cannot physically distance. So it does not essentially undermine the evidence, the critical importance of mask. This is our vaccine today. So the importance of mask continues to be important. And even when we have a vaccine, we know its effectiveness and efficacy and safety measures in the start, it will be expected to be 50-60% effective. Plus, in terms of manufacturing and distribution capacity, it will take the world at least a couple of years to make sure everyone in the world has this vaccine. So it will be a month and year-long effort. Till that time, wearing the mask is our sure way. Physical distancing and hand washing are the three known interventions, and if you want to equate them as equal to vaccine, definitely mask is the vaccine for today till we have a safe, effective vaccine and it's accessible to every individual in the world. Making sure that vaccine is available in an equitable manner even to those poor countries who cannot afford to vaccinate, because the reason being we can only address this virus until and unless we vaccinate when we have the vaccination everybody, because no one is safe till everyone is safe. Similarly, no country is safe till every country is safe, regardless of their purchasing power. That's where WHO has brought the governments, manufacturers, and donors together to have this effort as a global effort available to keep humanity at the global level safe. The point again here is that this is because an unprecedented outbreak. Emergency use listing is primarily given by the regulatory authorities in those countries. These are sovereign countries, sovereign regulatory agencies giving sovereign approvals to the manufacturers in their countries. Emergency use listing means that in case of an emergency, though you are not sacrificing all safety and efficacy norms, but because of an emergency, you will fast track the allowed use, or maybe an unintended but a safer use of a previously existing product. But if it was normal times, there will be more rigorous monitoring and evaluation. But because of knowing the humanitarian impact on humanity, we fast track these. And of course, this does not mean that it has been approved in a way, in a normal non-emergency sense they would get. So that is what is meant by emergency use listing. Now, as far as we were talking about availability of vaccine by mid-2021, yes, that is, we are all cautiously optimistic that we will have. However, with limited efficacy and effectiveness, safety of course paramount, but effectiveness maybe of 50 or 60%, and also it will not be available for the whole world. As a first priority, we will be targeting, and this is the WHO guidance and globally negotiated criteria, it's being negotiated, and the member states know that the first priority will be healthcare workers and first responders, and second, primarily elderly and those who are at highest risk in terms of their age and because of comorbidities like chronic diseases, cancers, HIV, AIDS, or immunocompromised. So again, by mid next year, we are talking about limitedly effective vaccine for a relatively 20% of the global population. For the whole world to get this vaccine, it will be a couple of years before we are able to provide this vaccine across the globe.
First office, what we call as Center of Excellence on Emergency Preparedness. So welcome to both events. In a way, it's a culmination of